Hello and welcome. My name is Jan Lingen with Painotopia.com, and in this video I would like to talk about trigger point activation in the pectoralis minor muscle. I would like to give you two examples here on how trigger points in this particular muscle can get activated, and afterwards I would like to move on and give you a few tips on what to do about it once they are active and how to prevent them from coming back over and over again. The first example I would like to give you is paradox breathing or exaggerated chest breathing. When you do not make full use of all your respiratory muscles, especially if you do not use your diaphragm properly and breathe quite shallow or breathe exaggeratedly through the chest, you are very likely to overload the muscles that assist in inhalation. And one of those muscles are the pectoralis minor muscles on the left and the right side here in the front of your body, here on the chest. When they get active, when they contract and shorten, they help you to lift your rib cage and expand it a little bit and thus help you to suck in that air. But as they are not the workhorses for breathing, but just usually should assist in breathing, they might get overworked quite fast and thus develop active trigger points, which then in turn might be troubling you. So now I would like to, let's give you first the examples on why you might have some shallow breathing or heavy chest breathing, and then let's move on. Okay, so in what cases do we use our muscles here on the torso, on the ribs, quite strong for the breathing? One thing is, if you do heavy intensity, high intensity sports, you are very prone to breathe a lot through your chest. And you might overwork those muscles. So for example, if you do heavy interval training, sprint training, high intensity cardiovascular exercises, that actually might overload the pectoralis minor muscles as well as the other muscles that assist in breathing, like the scalene, serratus anterior, serratus posterior, superior, and so forth. Another thing that might lead to an overwork here of those muscles is shallow breathing and strong chest breathing when you're stressed, when you have anxiety, when you might feel overwhelmed at your work, when you have financial issues, and they really trouble you a lot. You think a lot about that. If you have issues in your relationship, anything that really stresses you in a negative way, where you have the feeling that it's not any longer a challenge, but that it overwhelms you, that might lead to shallow breathing and paradox breathing here, and overly using those muscles that assist breathing as the primary breathing muscles. What to do about it? Obviously, in the case of sports, I will tell you later in the video what to do about it. In the case of stress and this shallow breathing, I think most of the times the issue is that most people are not aware of their shallow breathing. They're not completely aware of their level of stress. They might feel stressed, but they do not really, what's the word? They do not believe it themselves. They try to say, no, everything is okay. They deny a little bit the situation, and they're not completely aware of what's going on, or they do not want to know, or whatever. So it's a little bit more subconscious. And a good thing is to just try to observe yourself every now and then when you are in a situation where you are stressed, and almost all of the times you will catch yourself breathing quite shallow and breathing through your chest, and then just back off for a moment and take a couple of deep breaths and try to relax and calm down. That really can actually help. Okay, having covered the breathing and the possible activation of trigger points in the pectoralis minor muscle, I would like to move on to the more superphysical side in sports. So in sports, everything where you have to push a lot in front of your body or push downwards might become problematic and absolutely overload the pectoralis minor muscle, because it gets activated very strongly during those movements. Pushing in front, push-ups, bench press. That's absolutely possible to overload the pectoralis minor, or pushing downwards. For example, dips, or now we're not looking at sports, but walking on crutches. You know, you don't push too much, but you just push isometrically down to stabilize your shoulder joint. Or garden work, if you dig a hole, you know, in your garden. All those things activate the pectoralis minor massively, because it helps to stabilize here your shoulder. And for example, if you press in the front, the pectoralis minor helps that your shoulder doesn't retract too far, you know, it keeps it here in place. And with the downward movements, for example, dips and rings, or gardening, you know, digging a hole, it prevents your shoulder from an elevation and keeps it down here, so it stabilizes it. So it's a very, very important muscle, and if you simply overdo it with the physical activities, with the sports, it might get overloaded and might develop active trigger points. What to do about it, how to prevent them, I would like to dive into that right now. Okay, how to prevent trigger points from this, from those sports, from this strong physical activity. One very good idea is to progress slow in the intensity and the volume of your training, or whatever you do. In sports, you can control it yourself quite good. You know, give yourself enough rest time, recovery time between training sessions. Increase your weights or the resistance or whatever you have in your training only at very small increments. Don't make big jumps. And so this way, help your body, help your muscles to catch up, you know, to really adapt in a healthy way to the training stimuli that you place on them. Now, the same goes with the gardening example, you know, try to not garden 6 hours at a time if you are usually a quite inactive person and not very fit person. Take some breaks and thus lower the chance of trigger point activation. Now, obviously, with walking on crutches, it's a little bit harder to get used to that. So definitely you can, of course, walk only for a couple of meters and then give yourself a break and walk again, but sometimes you simply have to walk, you can't do that. So that leads me to the next point. What to do once trigger points are active? Once you overdid it in training, once you had this injury and you're walking on crutches and you're so happy that you are mobile again and you can walk, or you garden a lot and boom, the pectoralis minor developed active trigger points. Now what to do about it? Massage it. It's simple as that. Massage that muscle. You can massage it with your fingers, you can massage it with a ball, tennis ball, a cross ball, or a cork ball, or whatever, some kind of ball against the wall. That works quite good. Or you can massage it with a massage stick, like with the trigger fairy, and thus help to loosen up that muscle tissue and help to deactivate the trigger points. If you're new to the topic of trigger point self-treatment, if you have no idea where to start, how to find those points, how to massage them, how often to massage them, how long to massage them, if you would like to know how they develop in general, the physiological principles behind that, and it's very good if you would like to know about all that, because it will make your treatment so much more effective, then sign up for the free trigger point course here below this video, just by clicking on the link or the button below this video. And another very important tip that I already gave you is the correct pacing, the way you progress with your training intensity, the recovery times between sessions and so forth. So also have an eye on that, and use common sense. That's something that is lacking a lot of times, at least in my experience, what I see. Sometimes that's a little bit strange. If you use that, some common sense, you use the infos in that video and you massage yourself, I'm quite sure that it will help you a lot. Thank you for your time. I hope you enjoyed this video. If so, then please leave thumbs up, subscribe to the channel, and if you really want to support me, sign up for that course below the video. Okay, maybe I will see you in one of my other clips. Till then, bye bye.